I want to go to the second major cause of all your problems in your body, and that has to do with the spine. So the spine has these lovely curves in it, and we want to keep these curves in the spine. Because just like an egg is strong because it's round, it's stronger than a square box, the spine is strong because it has these curves. Now the curve I'm showing you here is the curve from the side view of the spine, as if you're looking at a person from the side. But if I were to x-ray all of you today and take an x-ray picture, I would see that you have a slate curve going this way. So the truth is that when we superimpose the side curve on the front curve, we get a spiral. And the spiral is the most resilient, springy structure your spine can have. And that's why when you jump out of the apple tree as a kid, you didn't break your back, right? So the reason why we have these curves in the spine is because these vertebrae in the lumbar area here are all wider on the front edge than the back. Wider here than here. Wider here than here. Now when we get up in the thoracic area, these are all wider at the back and narrower at the front. In any event, these spaces between the vertebrae have to be parallel, because these spaces contain the disc material. And the disc material is made of two substances. One is gel, and the other substance is the ligaments around the gel that hold it in place. So I've got a little ball drawn in here. This is the gel in that vertebrae. And each one has a little ball of gel in the center and fibers around the outside edge here. So just to show you what the bottom vertebrae looks like when you're looking at it from the top down, you see this is the body of the vertebrae here, and all these rings of fibers here they're just like a donut. They're holding this gel in the center right here. But right behind these fibers is the spinal cord right here. And this spinal cord is protected with all this bone around it. So nobody can come up behind you with a stick and poke you in the back and harm your spinal cord. That can't happen. But this spinal cord here is vulnerable if this disc here starts to shift and go back in the backward direction. So this picture here shows you the neck vertebrae, the thoracic vertebrae, and the lumbar vertebrae. And you can see there's a lot of bone on the back of that spine protecting that spinal cord. But right here you can see if this disc migrated back here, it's going to push on the spinal cord. Now, all the parts of your body are blessed with arteries, arterioles, capillaries, veins, nerves, and lymphatics. And your disc is no exception. Your disc has all that, but only till you're 18, because it's only there during the growth period. So as soon as growth is over, now all those little arteries and veins and nerves and everything that were in your disc, they're now gone. And they just disintegrate and disappear. So if you hurt your disc now, if you push that gel through those fibers, you won't feel it, because there's no nerve endings in there to tell your brain something's going on back here. So now, what do we do in our culture all the time? We sit. And we sit in front of the computer, and we sit in front of the TV for hours. And I'm sorry, I got you sitting here in a seminar. And we sit in cars, sometimes for days at a time if we're taking a long trip, but we're sitting all the time. And when we sit, we straighten that lovely curve in the back of our spine, in the lumbar area. And when we straighten this, because these bodies of the vertebrae are made of bone, they don't change shape. So we've taken all these wedge-shaped vertebrae and we've put them in a straight line. So the only thing now that can give is the disc. So we're driving this gel out the back of these discs, and we don't even feel it, because we have no pain receptors there, so we don't even know it's happening. Now when this gets further advanced here, and it's pushing on the spinal cord, guess what? Again, you don't feel it, because the spinal cord is a transmitter. It transmits information down and information up. But the spinal cord itself does not feel anything. It has no pain receptors. So it's just like if you went outside and you climbed a telephone pole, and there's all the wires attached to the pole, and you're talking to them, and you wonder why your wife at home doesn't hear you, because the wires don't hear you. And the same thing here. The spinal cord does not feel it when the disc is crushing it. So it's now interfering with all that information coming down the cord and going to all these organs and all these muscles, ligaments, and tissues all the way down to your big toe. So to give you an idea of some of the organs that this can affect, because we're affecting the lumbar and sacral plexus with a protrusion from the disc, we can affect everything from the liver down. So we're going to interfere with the liver, the gallbladder, the pancreas, the spleen, small intestine, large intestine, kidney, urinary bladder, and reproductive organs. Now think of all the women you've known who have had premenstrual tension. I mean, all the comedy writers, they talk about PMS, and it's just a plague in women's life, PMS. And think of all the fibroids they have, and endometriosis, and periods that don't come at the right time, and too much bleeding, and on and on and on. And the men have all their problems. I'm not describing them. So then there's all the constipation and the, all the other problems that you have, and gallbladder attacks and everything. And the position I'm going to show you, if you get a gallbladder attack, this position is going to take that away very quickly. And it takes all the pressure from the disc away. So it's well known in the medical community that sitting causes this problem. And I took all these pictures out of medical books. I didn't make these up. So here's the person bending over. They happen to be lifting a child here, but you could be bending over doing carpentry work, vacuuming, dusting, cleaning, scrubbing, anything where you bend over and you lose that curve right there. So the other thing is sitting, and I already said the computer, the TV, and the cars, we're just sitting all the time. And so it's well known that this sitting is the cause of this back problem. You don't actually hurt your back walking or lying in bed, and you don't even hurt it when you bend over and do this. It's just that you've been sitting so long. When you bend over and do this, that's just like the last straw. And then you go, oh, I can't get up now. So this picture, remember I said all the arteries, veins, lymphatics, nerves, and everything disappear out of the disc. Now it's quite possible when they disappear out of the disc that there's a little teensy hole in the fibers where it disappeared from. So when you sit all the time and you're putting that pressure on that gel to go to the back of the disc, that could be looking for a little hole. So this would be a normal disc right here, but we're putting pressure on it in the backward direction. It finds a little weakness in the fiber and it starts going through, and then it keeps going through, and it keeps going through, and it bulges the ligament there, and then it's putting pressure on the spinal cord. Now if it got bad enough, all that gel could go down the spinal cord, and if it goes down there, we're not getting it back. So that's why if you have any kind of a back problem, get on it, get it fixed.